Hey, Dr. Jonathan Shepherd here. It is so good to be with you all back for another edition of Ask the Doctors. I'm just getting myself set up here. Missed you all last week. Went ahead and took a pause. And so much has been said about pause. I thought I would utilize that particular phrase in relation to all that has occurred. But it again is a privilege to be with you on another Friday evening. Ask the Doctors, which is sponsored by my company, Hope Health Systems, where I serve as the Chief Medical Director. And Hope Health Systems is a large mental health organization in the state of Maryland where we provide mental health services for children, adolescents, and adults. And so you want to get keyed into Hope Health Systems if you're in the DMV area, Maryland, District of Columbia, Virginia area. Man, I am so excited to be with you all once again. We have an awesome show. We have an awesome presenters or panel of presenters. I am so privileged. And before I even go there, because if I go there, we're going to have to just jump right to the show. But there's just some things I just want to share with you all. A lot of things are on my heart today, and I want to be able to really emphasize the need for continued vigilance as we go through the COVID-19 pandemic. We are approaching 600 million, I'm sorry, 600,000, not 600 million, 600,000 deaths, according to Johns Hopkins data. And it's possible that by Memorial Day, we will have experienced 600,000 deaths due to the coronavirus. And that has taken such a toll on us, taken such a toll on our families, professionally, personally. And that is what we're going to talk a little bit about today. But we have to remain vigilant. Let me tell you who is the population who's being affected right now the most. Ages 20 through 40, the 20s, 30, 40-year-olds. Those are the ones who are really driving the infection rates right now. And I know a lot of it has to do with hesitancy. A lot of it has to do with mistrust. A lot of it just, and when I say mistrust, it has to do with mistrust of the government, mistrust of science. And I want you to go back and look at some of our previous episodes that have dealt with vaccine hesitancy and myths, because I want people to be encouraged. I want people to be informed so that they know what they're doing when it comes time to take the vaccine. It's wonderful to hear that we may be approaching herd immunity in certain states, but there are certain states that are nowhere near. Here in Maryland, we are about 37% fully vaccinated. That's not close enough. We need to at least double that, more than double that to get to herd immunity. So I'm just encouraging people to please be aware. Also, this week is Children's Mental Health Awareness Week. And so we're wearing green today in support of that. And Children's Mental Health Awareness Week is so important because our children are definitely affected by the pandemic. And we're going to get into that discussion today. I think that's just about all I really want to share today. I think some other things I will share as we go into. I do want to, and I'll do this again at the end, I do want to wish all those mothers out there a happy Mother's Day. This is Mother's Day weekend. A different Mother's Day weekend than last year for me, because I'm actually able to have my parents here with me. My parents actually made the trek from Chicago to Baltimore, and so they are here with me. And so if you see them walk on through the show, that is them. I'm not a stranger. I'm not being attacked. But yes, they're here with me. This is their first trip since the pandemic. And so I know many of you all understand that because you were unable to be with your families for many of the holidays last year. And so thankful that they have made it here, and so thankful that they have survived thus far through the pandemic. So want to again wish you a happy Mother's Day. I'll say this caveat and then I will transition. Mother's Day can be quite an emotional day for many people. because you think about your mother. If your mother is now deceased, has gone on, has now passed. But there's another group of people who I also want to address who could be emotionally affected by such a day. I was reminded that there are people out there who have suffered miscarriages, who once thought they were about to become a mother, and for whatever unfortunate incident, they no longer were able to carry the pregnancy through. Man, uh, when I was reminded of that, that really struck a nerve with me, and it resonated with me. And so I want to let all those mothers know out there, or future mothers, that you have our support, you have our prayers, you have our best wishes. And I pray that you will be able to carry a pregnancy all the way through, or whatever means that you want to be able to do. That just really hit hard this particular week when I was reminded about that. So just wanted to put that out there. This show today should be able to help inspire you, encourage you. I told my friends earlier that I had a lot to say, and I think I'm going to cut it off right just there. But it is so good to be with you all once again. Thank you, Chris. I'm just going to acknowledge a couple of people out there. Send me some comments. Let me know that you're watching. Thank you, Chris. Thank you, Letitia. Yes. Dr. Marilyn Griffin, who is a regular on here. She is out there. Yes. And she says hello to my parents. Thank you so much. All right. It's time to get this show rocking and rolling. I have some incredible people with me, people who I highly respect, who I really am privileged to work alongside with in the field of child and adolescent psychiatry. I'm ready to bring them on. So please, as they're coming in, send some comments. Share this. You want to share this particular video. If you have a child who has been negatively affected, or you are concerned about because of the pandemic, you need to watch this show. You need to share it. You need to text somebody, let them know to get on right now. I also want to acknowledge all those people who will watch the replay. We have triple the amount of views after a show goes live. So I'm never worried about the live viewers. I love you all. Please continue to do that. And I want you to join in with the replayers. Yes. Oh, my presenters are smiling because they know I want to make sure that everybody feels welcome. So yes. All right. Let me go ahead and present. I want to present this person first because I've known her the longest of the two. And so she's going to come on. This is Dr. Sala Webb. How are you doing, Dr. Webb?
Friday greetings to you, Dr. Shepard.
Thank you. Friday greetings to you also. How are you doing there in Arizona?
We've had triple digit weather this week in Phoenix, Arizona.
Oh,
So we're just about right on track, I guess, where we usually are. We go from winter, and then we may have a couple brief blinks of spring, and then we jump right head first into summer.
wow. Well, it's something like that here. Well, in Maryland is not summer, but we are experiencing some cooler than normal temps, and it's
Ah.
raining. Yeah, it's in the low 60s, actually in the 50s right now. But I don't pass out. Yeah, and so watch. The next time we come on, it'll be 80s, 90s, something like that. Isn't that something? But yeah, so tell the people a little bit about what you do. Let our listeners know about the phenomenal things that you're doing.
Well, thank you very much. As Dr. Shepard mentioned, I am Sala Webb. Currently, I serve as the Chief Medical Officer for Behavioral Health at the Arizona Department of Child Safety. And one of the main reasons that they brought me on board was to help create a Medicaid health insurance plan for the Arizona kids in foster care. And I'm very happy to say that from April 1st of 2021, our integrated Medicaid-based health plan has gone live for the Arizona kids in foster care. So
Wow.
very happy about that. And I know Dr. Shepard and my other counterparts here this evening are still doing direct patient care. But I am also a child and adolescent psychiatrist, but I am more active in the administrative system of care realm, particularly the Arizona Medicaid system. So as we get into the meat of the discussion this evening, I'll be sharing that perspective with the folks here today. So very happy to be here. Thank you so much, Dr. Shepard.
Absolutely. And we need that perspective because a lot of people don't understand what goes on that really drives care. So that is so important. Thank you. Thank you so much. She's a person you should know, just so you know. All right. All right. My other friend, who I met just 2 years ago in Chicago at the American Academy of Child and Adolescent Psychiatry Conference, and appreciate him. We clicked, bonded, and this is a wonderful person. Come on in, Dr. Larry Mitnaul. All right.
Thank you. Thank you,
Yes,
Dr.
sir.
Shepard. I appreciate that introduction and for the work that you do. I mean, it really is a privilege to get to be here with Dr. Webb and you and Dr. Means and to really talk about, what is near and dear to, I think, all of our hearts, obviously, the welfare and mental wellness of the kids in our communities. So,
Great.
so for those watching, so I'm from I currently reside in Wichita, Kansas, where I've been for the last 4 years. So kind of Midwest, and so I was brought here to build a clinic. So I started a child and adolescent psychiatry clinic within Ascension Health system, and so we've been just growing over the years, being able to bring on staff and therapy and that sort of thing. And has been really a lot of fun. And so when I'm not primarily in the clinical role, seeing young people, I spend some time doing some work collaboratively with the American Heart Association, just talking about mental health and physical health and how those two things go together. And so I've also been able to start some things and trying to reach children and families where they are. And so got to start a YouTube channel about a year ago, and then that has kind of morphed into some other projects too, which I'll probably be talking about a little bit later as well, which include currently a PBS show through Kansas PBS called Cause for Hope, whose primary motive is to really kind of educate the public and to reach teens and families about mental wellness and helping them to thrive. So I'm really excited to be here and a part of this conversation.
Wow. Wow. I told y'all these are tremendous people. That is so much. So thank you, my friend. And then Dr. Ronald Means is here. And, I've known him probably the longest. And so we're going to have him come on in. How you doing, sir?
I'm doing well. Good to see you, Dr. Shepard.
Yes, sir. Yes, sir. I was about to take a little trip down memory lane, but I won't do that.
Yeah, we don't want to subject people to that.
No, I am thankful for Dr. Means being here. He is a tremendous person. And just tell people a little bit about what you do, where you practice, and we'll get this conversation started.
Absolutely. Well, good evening, all. My name is Ronald Means. So I'm a child and adolescent psychiatrist, a general psychiatrist as well. But I also have additional subspecialty training in forensic psychiatry. I've been in the Maryland area now for over 20 years and came in for training and have been practicing out of training for 13 years. That has evolved over the years. The largest chunk of my clinical work for many years was being the primary doctor at the crisis program in Baltimore City called the BCARS program, where we work to treat children and adolescents who are having mental health crises in order to prevent them from needing higher levels of care, such as hospitalization. But as I've gotten a little older and time has passed, I've taken on more administrative tasks. So for the past couple of years, I've served as the Chief Medical Officer for Catholic Charities of Baltimore, the Family Services Division, which the BCARS program is under, but also a number of other mental health programs for children and families, including a residential treatment center, a therapeutic school, as well as a number of outpatient mental health clinics around the state. And that's what consumes my time.
Wow. Wow. Look at this. Chief medical officers, all three of you all. I mean, this is phenomenal. You have 3 Black male child adolescent psychiatrists on one platform. That in itself is history making. And then to have 4 accomplished child adolescent psychiatrists. Thank you for being here. I wanted to say, kind of reset the room, as they say. I want you to please share, please like this. We're about to jump now into the conversation. You hear our panelists are well informed. They're able to share with the different questions that we have. So I just want to set the tone. I'm going to start with you, Dr. Webb, first. Just give us some insight as to what you believe the current state of mind of our children are. And you can go right there, be there in the Arizona region or even across the country. But just give us some insight as to what you have seen in our children since the pandemic started.
Since the pandemic started, so I'll share a couple of thoughts I have to share on that topic to get us started, Dr. Shepard. Unfortunately, since the pandemic started, we have noticed an increase in a number of specific metrics when it comes to our youth population here in Arizona. And one of that is unfortunately increase in overdose and suicide.
Wow.
We've noticed that. What we've been seeing, I would say, the past month here in Arizona, that has not been something that we have seen at all before, is an increase in the kids needing hospitalization and higher levels of care. And so I'll give you a little bit of context. So again, I'm talking from kind of the state Medicaid perspective.
Mm-hmm.
So it's not uncommon that, for instance, around the summertime, we would see a dip in the number of children and adolescents that would be presenting to our emergency departments for psychiatric inpatient treatment and those who needed inpatient psychiatric treatment. And then when the school year started around late August, September, we might see an uptick. So that was kind of the trajectory that we are accustomed seeing. This past month, our emergency departments across the state have been so jam-packed. I'm not making this up. I've had kids in the emergency department waiting on an inpatient psychiatric bed that have been in the ED for over 200 hours, waiting on a psychiatric bed. And it's a backlog from all aspects. So we have kids waiting to get into the hospital. And then we unfortunately have kids who have had so many hospitalizations or at such a chronic level of acuity that they're waiting for residential treatment. And we've had a backlog, so they're waiting to go to residential treatment. And it's such a situation that even here in Arizona, I'm sending kids to Nevada for inpatient psychiatric hospitalization because I have no beds in Arizona. So this is unusual. This is highly unusual for us. And I do think the pandemic has played a significant part in that. And I know our other guests will be able to give a little bit more detail from the direct clinical lens. But from a systems perspective, that has been a very significant challenge for us. And in talking with some of the psychiatrists and clinicians that are working in our emergency departments, I mean, they're doing the best they can starting to treat some of these kids. So, we have a kid that might be there for a week and again, that's not a treatment setting, right? So it's everybody moving in and out of the ED, but okay, maybe we'll try and adjust some medications. Maybe we'll try and talk to your outpatient case manager and therapist and see what other plans we can come up with. So they've been doing this ad hoc treatment from the ED. And so, we've been able to disposition some kids from that perspective. But some of them are really that sick that we are waiting for inpatient. And again, the other thing I wanted to point out is I unfortunately have also seen an increase in overdose substance use. I think and I don't know if this is true everywhere else, but something I've noticed here in Arizona is that for adults, it is a little bit easier to get into some type of substance use treatment program, whether it's residential, whether it's an IOP, intensive outpatient, whether it's evaluation for medication assisted treatment or something like that. But it's not that easy on the adolescent side. But I think we're not asking for it, we're not looking for it, we're not assessing for it, and I think we're missing kids until they present to the ED intoxicated or to our ICUs on a vent, and by that time it's a little bit too late.
Wow. Wow. What a powerful start. Dr. Larry Mitnaul, go ahead. Tell us, what are you seeing in the
Yes,
Midwest?
thank you. Sure. So my some of the things that I've been appreciating are these. I and just to give people kind of a backdrop. So in Wichita is kind of the largest populous city in Kansas, and so it's about 640,000 in the greater metropolitan area. And so, as you might imagine, about a place like this in the middle of the U.S. for a population of this size, I'm one of three board certified child psychiatrists who can see kids. And so certainly with the ebbs and flows, and this is certainly has been kind of a season of really a rising tide of kids and families who are seeking care during this time. It's been really hard actually to kind of keep up with the demand. I mean, during this last year of going through COVID, many of the community mental health centers that often are seeing some of our illest kids are providing a lot of the wraparound support services, like Dr. Webb was mentioning, with case management services and social work. They lost people, and so I think both from a services standpoint, I think a lot of our children that are struggling, that typically had the services, haven't had or been as well supported or fortified through this time. And so it certainly put an additional kind of burden and stress on families. And so for my own clinic, I was able to bring on a nurse practitioner, and we have a therapist and some occupational therapy kind of resources and things for kids as we've been growing. But even still, with trying to increase access and improve our ways of getting kids in. I mean, for a new patient evaluation, for me, my schedule is kind of building out to October, November. Now, thankfully things may open, and our clinic is working on efficiencies, but that really is a system in strain. And so our local medical center, which is KU, they have a school of medicine in Kansas City, and then here in Wichita, their child psychiatry program has had to put a pause on new patient referrals just because
Wow.
of the limits of their capacity. So again,
Wow.
that means that really, of the three of us that remain open and trying to get these kids in, really there are only two options if parents are looking for a board certified psychiatrist. So that's one kind of angle which has been difficult to navigate, and I think has caused the community to have to think really creatively about how do we reach families where they are, how do we support our colleagues in family medicine and pediatrics on the front line too, to help them, to help us too in really giving good care to the kids that we see. Recently, there was a newspaper article by the medical director of a pediatric ICU in the University of Kansas Health System. And so he was quoted as saying, throughout this year, there have been thousands, not hundreds, but thousands of kids that have been missing from yearly wellness exams. All right. So, I mean, which sounds, maybe to certain people listening, that, is that, how big of a deal is that? Well, you can't catch what you don't see. And so,
Right.
if we're already having a hard time, with managing the kids who are identified, we're also missing out on, on ways of capturing maybe some other kids who might be flying just below the radar, and certainly maybe in positions where they have kind of less oversight, less supervision, depending on what their school kind of setup looks like. And so maybe I'll end my brief summary with this on a lighter note, which is, as I was mentioning, some of the early signs of or kind of small successes through this have been just the number of agencies, both through the state and private means, really trying to come together. I mean, I don't remember a time at least in these last 4 years, where I've seen as many, public service announcements and flyers and, people, going to the school system and trying to come up with free programs to equip people in the community, teachers and clergy, and to really try to understand, depression, anxiety, and help bring messages of hope and support and helping kids to get connected. So despite how overburdened the system is, I think our community's been trying to be responsive to that as we're playing catch up to catch these kids.
Thank you. I mean, that's a good balance of how you describe that. And I like what you all have shared thus far. Dr. Means, jump on in. Tell us what you are seeing.
It's interesting. And I think the reflections of Dr. Webb and Dr. Mitnaul sort of resonate. It's funny because at the beginning of the pandemic, I think there was a concern and a level of urgency, people thinking that, especially for kids, youth, that at the onset of the pandemic, there was going to be the floodgates would open, right?
Mm-hmm.
Kids would be overwhelmingly anxious or depressed, and we all had to get ready. And it was interesting to see that there was actually a bit of a lull. There was a quiet time in child and adolescent psychiatry where folks weren't presenting, the kids especially. I think we got a lot more adult traffic, and the child and adolescent work actually began to calm. But I think it was the reflection of Dr. Mitnaul. That's the reason why. It's because the kids weren't in school, right? So they weren't being identified as having mental health issues and then being referred to mental health providers, or they weren't getting their regular checkups and being referred by their pediatricians. So what we're seeing now, as this has gone on, is you're seeing this much more ill population of kids. They're now seeking services, and they're now flooding the clinics and flooding the ERs and the inpatient units. I feel for you, Dr. Webb, because I was just on the phone today about one of the kids in our residential center who is on his second ER visit in 2 weeks. The first ER visit, he stayed in the ER for 2 weeks without getting an inpatient bed, only for us to say, you know what, we'll take him back. We know that he needs a higher level of acuity when it comes to care, but we don't want him sitting in the ER anymore. So we'll have him back in our residential center, only to have to send him back out, a day or two later, because guess what? He needed inpatient level of care. And now he's on day 5 in the ER again, waiting for an inpatient bed. So it is that it is that lapse in the services that I think are critical in order to maintain wellness in kids. And now we're seeing the results of that with this more ill, more critical, more acute population of kids, because we've missed those earlier interventions due to the pandemic.
Yeah, that's good. That's good. And we're going to pick up just right there. I just want to reset real quick. Thank you, Dexter, for commenting. Good conversation. My friend Letitia, she has a question. I want to actually hear that's a quick answer from all three of you all. And then I'm going to shift it to our next question. She asked a question about what is the average stay of inpatient psychiatric hospitalization for children and adolescents. So let's just start with you, Dr. Webb, just real quick. What are you seeing as the average stay there in Arizona? Yeah.
I'll tell you what it's supposed to be if you subscribe to a system like Milliman Care Guidelines or Interqual or something like that. It is supposed to be 3 to 5 days, on the higher end, 7 days. That is what it is supposed to be. What we're currently seeing right now is that it is much longer than that, especially for children and adolescents who I would say are, in my case, who are in the custody of the state. It is unfortunately much longer than that, because here in Arizona, one of the stipulations that we have is that if we have one of our kids in foster care that had to go to an inpatient psychiatric unit, and if we are not able to solidify and confirm an appropriate disposition with appropriate outpatient services, then they are to remain inpatient until that is done.
Wow.
So let's say someone went in for suicidal ideation or something like that, and let's say from a clinical psychiatric standpoint, they would have been cleared for discharge by day 3 or 4, meeting all appropriate standard of care guidelines. If we are not able to secure an appropriate discharge setting with appropriate outpatient services, that can tack on some time to their stay. And under that rubric as well is why we're having so many waiting to go to residential treatment, because it is felt that, okay, if that child has now been approved or identified for residential level of care, we can't then send them to a DCS congregate care home or to a foster family who doesn't have the ability to provide that intensive level of care. So to err on the side of caution, the system is waiting to do a hospital to RTC transfer to make sure that that youth continues to get that intensive level of care.
Gotcha. And that could take days,
Yeah.
Weeks. Yeah. I didn't mean to say that. That really could take.
It can take a long time.
It can take-
I'm gonna say
I
that.
got you. I got you. So I want people to understand that there are so many different cogs, or if you would, or different factors. I'll use that word as to how to make sure a child can get the appropriate care that is needed. Dr. Mitnaul, what's the average length of stay? Just quickly, what are you saying?
Yeah, sure. I actually, Dr. Webb said, I think did such a great job summarizing. That's what it should be, but it ends up being longer for those reasons. As she gave that scenario of a child who's ready to discharge from the hospital, but really they're looking for a great disposition in terms of kind of continuing care. And so I'm thinking, because of the phone calls that we get from the hospital, how quickly can you see this child? And if they're not already connected to care and need a new patient evaluation, I mean, that can be really, really long, and so you can see how that bottleneck, really doesn't serve the child's needs well, and certainly has the length of stay prolonged. So I think, kids, and so the kids that I might see at our hospital that adjoins my clinic might be a slightly shorter length of stay. But that also depends on, a lot of factors, including, their custodial kind of circumstances as well, and the things that they, need in order to be with their parents in the community. So prototypically, probably this time last year, we would have been saying 3 to 5 days, but I'm sure it's at least double that, if not more, again, depending on the circumstances.
Gotcha. Dr. Means?
Yeah, I'll give a slightly different answer. I think that when we think of what a length of stay should be, hopefully we're all saying that the length of stay should meet the needs of the child, right? That they should stay until they are well enough to be transferred to a lower level of care. So I know that certainly from a payer standpoint, or for what we think of when it comes to the rubrics of inpatient care, we often put some limits on that, or what we would expect, 3 to 5 days, 4 to 7 days. But, ideally, when we're sending kids for inpatient care, we should be sending them in order to get the care that they need, and not so much keeping in mind how many days precisely that should be. But realistically, we are all in the, business of healthcare management, and we know there has to be limits and stipulations and monitoring of that. So generally 3 to 5 days, 4 to 7 days is what one would expect for inpatient care. But as what everyone else has said, due to the level of severity of illness right now, those stays are longer, and due to the lack of resources when it comes to stepping people down to the services that they need outside of the hospital, whether that means going to an RTC, a residential treatment center, whether that means going to a day hospital program or intensive outpatient program. All those things have been so dramatically affected by COVID and how they function that it's all disrupted. So
Right.
these lengths of stays end up being longer, potentially unnecessarily.
Gotcha. Yeah, and there's just everything has been affected by the COVID-19 pandemic. Our hours that we work, the volume, even our salaries have been affected by that. So let me now ask this question, because this is the question that I'm getting from parents, and this is the question that drew some people even to this show today. People want to know, will my child bounce back from the pandemic? That's what people are asking. People want to know, how can I assure, if that's a good word, that my child will bounce back from the pandemic? And I want to hear from you all. I want to hear from you, and I want to even hear from our audience. Please share with us, what some of your concerns. Dr. Webb, you're up first. This is quite a question. Yes, will my child bounce back from the pandemic? And you can lead from any way you desire.
I will say, if I may rephrase it a little bit differently,
Absolutely.
I would say there are things we can do to help the likelihood that children will bounce back from the effects of this pandemic.
Mm-hmm.
And as you know, Dr. Means and Dr. Mitnaul have been saying, the current resources have been a little strapped when it comes to mental health services around the country, but I don't think that should deter anyone from seeking them,
Mm-hmm.
because
Good
they're
point.
still available. There are many, like for instance, here in Arizona, there were many flexibilities that we made in the Medicaid system, as far as allowing more codes to be billed via telehealth or telephone services,
Mm-hmm.
those sorts of different things, laxing on some other stipulations to make sure that people get care. Excuse me. Enhancing our crisis mobile teams and different things like that.
Mm-hmm.
But I also want to say that, as child and adolescent psychiatrists, we know that part of resiliency in faces of challenges like this one is making sure that the youth is surrounded by adults who can model that for them. So I think if we want our kids to be resilient at this time, we have to make sure that we as parents and caregivers and their adult community are also taking care of ourselves,
Mm-hmm.
and that we are doing what we can, within our means and our ability to take care of ourselves, make sure we're eating right, we're watching our stress, and that we're communicating with our youth. And I think that is something that we often take for granted, and we make assumptions that, oh, either they don't understand or either they wouldn't care. But I think we do have to be transparently and openly communicate with them. And it may be okay to share with them that you might be concerned about something or worried about something, so that they can see your humanity and also see how you are dealing with those stresses as well.
Absolutely. So resiliency, the capacity to bounce back. And so, come on, Dr. Mitnaul, what capacity do our children have to bounce back? Will they bounce back?
Yeah, I like the focus that Dr. Webb added, and I agree. I think one is carrying forward the message that there is a cause for hope, and that our treatments really do work, and not to be discouraged from individuals and families kind of seeking the care that they need. And her point too about us being able to model to our kids that in times of imperfection, and when we can't maybe have all the things that we want, that adults can rally together to serve the needs of our kids and to try to provide that community. I think one of the things that teenagers, the teenagers in my clinic would have said to me, a year and a half, 2 years ago, is that Dr. Mitnaul, I can live my life virtually. I mean, I can live on TikTok and Snapchat and
Yeah.
Discord, and my life is fine. And what we learned is those teenagers were actually the first ones to say, hey, I need to be with you in person. There are some
Mm.
conversations that I can appreciate the telehealth check-ins, but if there's an opportunity for us I'll be 12 feet apart if that will allow us to
Wow.
to get to the things that mean the most to me. And so I think some of the things that we can also focus on are looking for real points of connection with our kids and with kids in our community. And that might mean volunteering our time to be that for people that that we know may not have all of the same resources, and looking for the healthy ways that kids can still participate in community and be with one another, or be connected to their church community. All of those important pillars that we know help to really bolster and support our kids, and give them opportunities to find those adult mentors too. Because I think that was one of the hard things about this year, is that many kids, both parents are working kind of outside of the home too, and maybe they were doing remote school where they are their own companion in the house, other than maybe the dog and the cat and your little brother, and who wants to be stuck with their little brother. So looking for ways to build that in, and help them to reconnect can be really important to help build that resilience. And so I think because of that, we have cause for hope.
Gotcha. Dr. Means, I want you to tackle that question. And if so, if they will bounce back, provide some type of recommendations too, if you would. Dr. Webb has provided some, Dr. Mitnaul, and I'm just going to ask for you to also provide some of those recommendations of how they can bounce back.
Absolutely. You got to mix up the order here, Jonathan. I can't follow these guys. They say too much good stuff. There's nothing left to be said.
All right, then be ready. I will reverse the next time around.
But seriously, I think that certainly all that's been said is very useful. What has always struck me as grossly evident, and this is years of doing crisis work in Baltimore City, which you guys can imagine is hard. Is how resilient children are. Children who have been through horrendous things. I mean, it is ingrained as part of our being, especially as kids, to bounce back. But there are certainly things that we can do to help move that along and facilitate it. And certainly everything that Dr. Mitnaul said in terms of building supportive communities, getting them engaged, maintaining their physical well-being, having community outlets, all these ways to establish some sense of normalcy for them so that they can draw upon that inner resilience is critical. But then, as Dr. Webb said, modeling for them as an adult how to care for oneself is critical. I feel like in the research, time and time again, there's yet another study that comes out that says, hey, you can actually have a parent who engages in some sort of treatment. Even if a child is the identified patient and the parent actually does some sort of therapy intervention, that even without the kid participating in that care, the kid actually improves, right? And that's because a parent, right, if they can take care of their own emotional well-being, if they can demonstrate what they need and want to see in their children, that child will do well. Even without directly touching the kid, right? Even without having interventions that are directly impacting that kid. So it's critical that if we have parents who are struggling themselves, that they have to get into mental health care, right? We have to push and we have to say, you got to take care of yourself in order for you to be the parent that you want to be, and thereby see the type of behaviors and emotional fortitude that you want in your child. You have to build that in yourself. So I'm always impressing upon my parents who bring in their kids and identify them as the patient. I'm always saying, what are we going to do to get you the help that you need? And I think that is a critical and absolutely necessary step.
Absolutely. I always tell people that when I work with a child, I'm working with the family. Sometimes I usually say it's a 2-for-1 type of deal, but yeah, I really am working with not just the child, but working with the family and with the parent in particular who brings that child in. And sometimes it really is grandmother, grandfather, all the other different people who are somehow influencing that child as he or she grows up. I am going to reverse the order here. All right, Dr. Bees. Yes. See, thank you. So I want you to speak to these fears, because in addition to the COVID-19, we have seen increasing violence. Here in Baltimore, believe it or not, there is a 17% increase in homicides. We just continue to increase the number of people who are killed on a daily basis. It's unbelievable. And I know that the mayor And the governor of Mayor of Baltimore, and governor of Maryland will be meeting next week to discuss plans. But children are fearful. That's the point. They're fearful of homicides, mass shootings, and racism, police brutality due to racism. I want you to speak to some recommendations. How do we address these fears that our children are facing during this time?
Now I regret having the order switched. It is there's been so much. It's a pandemic. It's violent scenes of police brutality. It's drug overdoses that are just skyrocketing across the nation. The collapse of educational systems. It's daily chronic community violence. There's just so much.
Yeah.
And I think it's hard to normalize that for us in any way, or try to shield ourselves from that as adults, much less think about kids. But our task needs to be finding ways to keep children educated, right? To make them aware, but also not overwhelm them so that we essentially shut them down by anxieties and fears, or create a sense of hopelessness that they're never going to get past this. And sometimes that's hard for us as adults. But we have to have enough awareness to be able to take that stuff in, process it in whatever way we can, maybe even have our own thoughts about that, and in some way refine those thoughts and those communications when we are speaking to children, in order to give them a glimpse of it so that they understand it, but as not to overwhelm them, as we would then shut them down with intense anxiety and fears. So it's that modulation of the message that we have to be constantly vigilant about when we're working with kids.
Gotcha. I just want to give you just a couple seconds, Dr. Mitnaul, so to get your answer together. I want to acknowledge Dr. Terrence Hayes, who's out there, Miss Audrey Moody, who's out there. These are faithful listeners. Come on, Dr. Mitnaul, what are your recommendations? I know some people say there's no violence in Kansas. Well, I hate to tell you.
It happens.
Absolutely.
And I think sometimes those are the stories that get amplified the most, and certainly that carry the day. Often are the really heartbreaking stories of either premature tragedy of a youth dying due to one of these methods, or a story about mental health that always that tends to push towards putting it in a dim light, or using mental illness as kind of the explanation for all of these things. And so I'm going to steal Dr. Means' terms of refining that message, and I think one of the ways that maybe families could think about doing that too is, we know that we're surrounded by a 24/7 news, cycle, and some of it is informative, but some of it maybe has an orientation more to entertain and maybe allow us to be absorbed by something. But these are things that we can maybe process and handle as adults that are reasonable to filter out. And so I like Dr. Means' message of kind of making sure that we refine the things that are most important for our kids, because we don't want them walking around with blinders. We still want them to be resilient and know how to present themselves, and where the safe streets are, and who are the responsible adults that you can turn to in times of a crisis. But as he said, we don't want to overwhelm them. So one is just kind of controlling the message, but then also maybe reaffirming in our kids just how strong and how loved they are, and how the people around them, their community, and point out the heroes that help to uplift them. Because ultimately, I think we can't be with them 24/7, but if we can identify for them the people who are there for them, who are in their corner, who are going to help them make the right decision or turn to the right person for assistance when it really comes down to it, or when they're outside of your supervision. I think that's one of the things too that can also be helpful.
Absolutely. Dr. Webb, jump on in here.
Absolutely. And in addition to everything Doctors Means and Mitnaul have said, I would like to offer something to consider as well. So we know that as a people, we are resilient for a number of reasons. And one of those reasons is our capacity for creativity. And so I would encourage to think of a way to kind of process and transmute this fear is through modalities of creativity, either as an individual or as a collective. So ways of expression, because sometimes, and especially even in therapy, working with young people, sometimes something comes out more in a creative modality than in just a discussion or a conversation. So whether that's visual arts or poetry or song or dance, and then sometimes doing that as a collective group constructively is also a way for some of that catharsis, and then moving towards now doing something with it. Because the trick about fear is that we don't necessarily want to be paralyzed by it or to enhance our paranoia to the point where we're either so angry or we don't do anything. So to figure out a way that after, our community and our parents have reframed and refined that message for us, and we know that they are supporting and holding us, that then, have a way for the youth to process it creatively and then do something with it. So I would kind of just offer that as kind of another way to consider moving through the fear.
Wow, that is so important. That's very impactful what you just shared. Because so many times we see how our youth are misunderstood. Now I'm talking about youth of color, children of color. They are misunderstood. There's never one way to be able to educate a child. All right. I've learned that. I've learned that even through my practice. I remember that even when I was in school, there was just people who they just learn differently. Our people tend to be more visual, more hands-on. Some people, they just can just listen to something, they got it. Some people need to read it and they got it. Some people need to see both. I was one of those people, I just need all three, Yeah. I mean, it's just, sometimes I was a little slow, but once I finally got it, I got it. But you have to have those type of people who are going to invest and take the time for our children and for parents, for those of you all who are parents out there, that especially if you have more than one child, that you can't treat the one child the same way as you do the other, because that child is different. Each child is different. And so it's just really something that you said right there, Dr. Webb, about creativity. One of the things I just learned too this past week is that with schools being reopened, many of the children are not back in school. So there are much smaller classes. And what has been amazing is that those who needed a smaller classroom setting, they're doing so much better now. Now, that's a whole other topic, but it's amazing though how they have just improved because they have more one-on-one attention. They're able to express that creativity that you were talking about because someone actually has now invested the time to be able to hear what they have to say. And that is so important, especially when our children are suffering from a mental health disorder. And so mental health disorder means they're not functioning properly. And so we see that in their sleep patterns, we see that in their eating patterns and their irritability. So this has just been so remarkable. I have a principal who's on the line right now. She's been featured by CNN, Principal Carlidia Thompson. So get ready. You coming? I got an invitation for you. I know I've been saying it publicly, but I got an invitation for you next month. So just get ready. All right. And so just get ready to say yes. But she's been talking about how teaching children the social emotional learning competencies helps to build their confidence, which they will foster into adulthood. So what I want to do in these closing minutes, because these wonderful child adolescent psychiatrists, man, I tell you, I'm just privileged. I mean, I just feel smarter being around them. I want to hear about what they're doing personally. We need to know that there are people out there who are not just talking the talk, but they're actually doing the work. And that really is what led me to ask these three child psychiatrists to be on this show today, because they're doing the work in the community and they need to be highlighted. And we need to see people, if you are a person of color, you just see people who look like you, who are actually doing the work, who can speak about the language and help be able to provide for you the recommendations. And so, Dr. Means, I just want you to tell the people a little bit about some of the work that you do. I don't know if he mentioned that he is a forensic psychiatrist. I don't think he mentioned that. The boy is bad. I'm sorry, the man is bad. Come on, Dr. Means. Tell us a little bit about what you do.
Yeah, so I mean, because I, have subspecialized in a number of areas, it allows me a lot of variety in terms of the work that I do, which I really appreciate. I mean, I think I went into it knowing that I had varied interests and I wanted to be able to work in all those areas. So, at my heart of heart, though, I'm a community psychiatrist. Okay, I love working with kids. I love working with underserved population. I love working with the impoverished population, and that is what I was drawn to do. I love nothing more than sitting in a room with a little kid who thinks he doesn't want to talk to me, and seeming disgruntled and irritable, and 5 minutes into it, having him chat away about his inner deepest pains, and that just brings me joy. And also working with that family and in order to help understand their own child and help them communicate better. So at my very basis, that's what I love to do. But you know as I've progressed in my career, um, as much as I love the individual impact with patients, I've also realized too that I have a capacity to help influence systems of care, that I
Mhm.
have the capacity to do larger administrative work that can impact thousands and thousands of patients. Okay, so I wanted to lend myself to that and offer my perspective, right, as a Black man, so that hopefully, as part of that larger work, I can do some work in righting some of the wrongs that are built into the system, just by offering my perspective. On the forensic side of things, I still do some forensic consultation work, which is a little different. I lend my services for legal cases or for lawyers or agencies who need some special consultation about matters. That's stimulating in a much different way. Intellectually, it draws on a different part of my brain, and it's just a different type of work that allows me just a small nugget of some, a little bit of more self-fulfilled, selfish work, that's more focused on my own intellectual curiosity. But again, at the heart of heart, I love sitting in a room with some kids and families and making it work better.
Absolutely, absolutely. And so, while we're on this, actually, just tell people, because as people are watching this, they're going to want to know where can they reach out to a Dr. Means, just in case there is some availability to be able to get to you and to Catholic Charities. And yes, I do endorse Catholic Charities, even though they are a rival organization to me in Maryland. That's okay. That's all right. There's enough room.
There's enough room. There's enough need, so we
There's
can
enough,
we can
yeah,
all work together to meet that need. But yeah,
absolutely.
Catholic Charities of Baltimore services many of the counties within Maryland, all the way over to Western Maryland, down to northern parts of Maryland, as well as going a little bit south. But we have clinics all around the state. You can certainly go on the web and look up Catholic Charities of Baltimore, and that will provide you a central intake number that will then help get you to the right clinic that's near you. Although everything's near you right now with telehealth, right? It's changed the way we work. But as we begin to move towards more in-person care, we can get you to a clinic that's nearby you, so we can help get you the care that you need in order to make you more healthy.
Absolutely. All right, Dr. Mitnaul, tell us a little bit. TV.
Yeah.
Yeah.
So,
Oh,
I mean, that's been one of the really fun things. I think, I coming into medical school, I did a combined program with the Masters in Public Health, and I remember being asked by family members, "How are you going to use that? What are you going to do that's
mm,
that's public health related?" And so it really, from doing being active in social media, kind of prepared the way to be able to do this. So we're on episode 3 of my show Cause for Hope. That'll air. The third episode will air at the end of this month, where I get to interview a Division I basketball player here for the Shockers, Dexter Dennis, who took an
wow.
indefinite kind of leave of absence from his season for his own mental wellness, and so talks
Wow.
about his journey and how NBA players hearing their stories helped to empower him to be able to tackle it. And now he's back on the court and leading the team and doing a really great job. And so, I think that I love that part. It's something that I didn't kind of plan to be a part of, but it's actually much more fun. And I can see why you enjoy hosting these. You get to uplift other really great voices too, who get to speak to
Yes.
resilience and coping in the face of adversity. And so, anyway, so it's a 8 part series, and it'll wrap up at the end of this year, and then we'll get to see kind of what happens next from there. So maybe a season 2, who knows? But I'm just having fun in the process, and hopefully giving a voice to some of the themes and topics that we've been talking about here.
And tell us, where can we find that?
Sure. So on I post all the episodes also on my YouTube channel, which is just, Dr. Larry Mitnaul. So youtube.com/Dr. Larry Mitnaul, where you can find all of that.
Wonderful. All right. I encourage you to go watch. I did watch the first episode, I believe. Actually, he was highlighted in ACAP news clips. That's actually what drew me first to it. And so ACAP stands for American Academy of Child Adolescent Psychiatry. And so I said, I know him. Oh, man, that's my friend. Oh, man. Yeah. I said, wonderful. Next show, I just reached out. I just love it. I just love it. Oh, man. And he did an awesome job. And I believe you're talking about suicide in that first show. Yeah. I'm telling you, it's stuck with me.
Yeah. Awesome. It was highlighting a really great program too, Suspenders for Hope. It's a free online program for educators, teachers, parents, anyone concerned, that can help them learn how to recognize the signs and symptoms, and also know what some of the kind of national resources are to help people get connected to care. So I really like that.
That's great. That's great. Give that name again one more time of that resource.
It's called Suspenders for Hope. So if you just Google Suspenders for Hope, it'll pop right up.
All right, Suspenders for Hope. That's great. Wonderful. And last but not least, Miss Wonderful, and we want to wish her a happy Mother's Day. This is your first Mother's Day, I believe, and so absolutely. So save the best for last here. Come on, Dr. Webb, tell us a little bit about some of the wonderful things that you're doing.
Thank you very much for the kind words, Dr. Shepard. And I am currently not in direct care, nor am I on TV. However, I get asked a lot from folks, do you miss doing direct care? And one thing I say to people is that I use my clinical skills every day. Because I tell you what, there's nothing like walking into a corporate meeting that is no different from a process group. And if you can't figure out the power dynamics and have a quick rundown in your head of the different personality clusters and how, unfortunately, yes, for anybody who knows me now that's watching this, I am managing you in the meeting and you just don't know. But anyway.
Come on here.
But this is what, 2021. And, if there's anyone listening, whatever field you're in, whether it's medicine or not, I encourage you, as Dr. Means was saying, if there's a way to get into administration or to get into get into the room or somewhere where decisions are being made, because unfortunately in 2021, I'm not only just still the only one at the table, I'm sometimes still the only one in the building. And that is, we should be past that now. I still get white mansplained and all those different things, but at least now we're at the table. Now I can start to call attention to things. Now I can start to speak to things. So I see that kind of as my mission, and that was one of the reasons that I took my current position at the Arizona Department of Child Safety, is that I wanted a way to try and move the system from internally, and it's been challenging because they never had one of me. So I had to kind of not only educate internally at the department about what I could do and how I could be of service, but then I also was there for the big role of helping create that health plan to serve the kids in foster care. And even in Arizona, where I know that 2020 census data is still getting processed out. But the census before that, African Americans were about 3 to 5% of the population in Arizona, but we were 16 to 20% of the kids in foster care. So disproportionately represented. So just a little shout out to anyone wherever you are. Don't be afraid to jump in, and don't think that you're not qualified, because your experience that you have, your perspective, that automatically qualifies you to be a voice at the table.
Huh. That's what I'm talking about. Close it out just like that. Thank you. Thank you. All right. If you felt just a little bit bad, you should feel a little bit better. I know I do. Thank you. My voice matters. So I'm glad to be at the table. And let me just tell you, it's been a tremendous pleasure to have all three of you all. You all will be back. I would love to do a show at ACAP. And see, I don't know if all of you, I'm not going to put you on the spot to see if you're going. I already know Dr. Webb is going to be, because she's upper echelon now with the second. She's the secretary of the assembly. Yes, and one-handedly. I'll leave that alone. But we're so thankful for her leadership, even in the American Academy of Child and Psychiatry, which we all four of us are a part of. And our annual conference is coming up in Atlanta. I would love to do a show while in Atlanta. I don't know if you all plan to be there. I'm not gonna put you on the spot, but I'm looking at some of these faces.
I'll be there, Dr. Shepard. Stop asking.
All right.
Me too. I'll be there.
Wonderful. I do plan to be there. I am going to present this time this year. Yes, in October. I think one of ours did get rejected, but one of them did get accepted. So I would love to do a show. That's the point. And to do it live from Atlanta, to have you all back on. This has been tremendous. I want to do this again because we're going to do a check-in to see how things have fared for our children coming back into the schools. I think, Dr. Means, you really hit it on the head when you talked about the lull and our children flying under the radar. I hadn't thought about it the way until you just presented the way in which you did. And with the schools opening back up, it's going to be interesting because there's going to be children who's going to be scared to go back into the classroom, just like there's adults. And they're talking about the pandemic anxiety. How do we recover from being isolated? How do we recover from the different things that we suffer? How do we recover from the loss that so many of us have seen and witnessed? So that's why we're going to have to come back and, again, give some more tips and from our different vantage points. This has been excellent. Hope Health Systems is a large mental health organization, yes, where there is plenty of need in Baltimore. And I'm so grateful to be working with them. Dr. Means, has been 10 years, believe it or not, that I have been with Hope Health. So I'm gaining in tenure. Yeah, he still got me now, but I'm coming.
We're still the same age, though, so don't.
I just had to get that in, just one. But yeah, a good friend of mine. I really do appreciate all three of you all. And so Hope Health Systems, 410-265-8737 if you're in need of mental health care, hopehealthsystems.com. You can go to our website and you can do an intake right there on our website so we can get the process rolling. If you're in need of mental health services, your children, you've listened to what we've said today, and your child is in need of mental health services, you're in this area, Maryland, Virginia, District of Columbia, will be glad to service you. All right, panelists, please hang tight. I am going to go ahead and sign off here. This has been excellent. Please share. We've had steady numbers throughout, which is good, which means that people were engaged. That means that people were listening. I love this. You're right, Dr. Mitnaul. I love doing this. I never saw myself doing this last, but I tell you, I was just taking it on kind of as my own little pet project. I have a passion for wanting to help people. So again, we'll see you next week. Next week, we plan to talk about the global impact of COVID-19. And I plan to have guests from Brazil. I plan to have guests from another country working on that. And so we want to hear how the COVID-19 pandemic has affected not just the United States of America, but literally has affected the whole world. And so we will talk about that on next week. Thank you all again. Please be safe. Please be vigilant. Please get the vaccine. All right. Take care. Panelists, hold tight.